afternoon, everybody. Good morning, depending on what side of the continent you are. My name is Shanda Demorest, and I definitely want to extend my gratitude, Jack, to you and Fiona, and of course, Jessica Madrid, and all of the rest of CANE for inviting me to come and hang out with you for an hour today and to talk about my favorite thing, which is environmental sustainability and climate action in the context of healthcare, but more importantly, as us nurses. And so, as Jack mentioned, I work with Healthcare Without Harm, which is a global nonprofit, also representative of Canada, that really sits at the juncture of sustainability and healthcare. And so that's the experience that I'm bringing to the table today. I spent about 7 years as a practicing nurse in Minnesota, actually, where I spent most of my life close to Canada, but not quite there. And now I'm calling in today from the Bay Area in California. So without further ado, let's get going. In our time today, we will spend a little bit of time reviewing and reckoning, climate change in 2021. Where are we and what this means for nurses? Then we will spend some time together talking about the imperative of nursing leadership. We'll dig a little bit into clinical action and how nurses can really have an impact on climate mitigation and adaptation at the bedside. We'll shift into talking about policy and advocacy just a little bit, but I really want to have a rich discussion or Q&A at the end, and I'll talk together about what you're working on, what you'd like to work on, and get a little better feel for what some of this work looks like in your area. So to kick it off, I pulled this off of the Canadian government's site about greenhouse gas emissions in the country. And here in the US, in the last few years, there's been a little bit of push and pull back and forth between what industry is the worst bully when it comes to greenhouse gas emissions. Which industry is the worst kind of bully of climate change? And it goes back and forth in this country between energy production and transportation. And I thought, well, what does that look like in Canada? Because when we're trying to contextualize how to address climate change and the environment from the healthcare perspective, it's good to also have an idea generally of how your country contributes to GHG emissions. And when we think about greenhouse gas emissions, just as a reminder, basically, this is really about burning fossil fuel for the most part when we think of an industrialized nation. So back towards the mid-1800s, there was this terrific discovery that burning coal and oil and eventually natural gas was really efficient at the time. And that is what our ancestors, and now of course us, have used to heat our buildings, keep our lights on, fill our gasoline tanks. And in a healthcare setting, that's what we use to keep the lights on in a patient's room and cook the food that patients eat, power the MRI machines, create the products that we use to take care of humans as nurses. And so looking at Canada, you can see that this is really heavily leaning towards the energy sector. So you can see in this sort of teal color that about 44% of greenhouse gas emissions in Canada come from this stationary combustion source. But then there's more energy down here. So over 50% of greenhouse gas emissions in Canada hail from the energy sector. And transportation is about 30%. And perhaps that speaks to a variation in population. But there are all other sorts of angles that contribute to GHG emissions as well that you can start to think about, well, how does this happen in healthcare? Of course, in the nursing practice, we often think about waste and what we're using, again, to take care of those patients at the bedside and what ends up in the landfill, maybe breaking down to contribute to the release of carbon dioxide and methane specifically. Agriculture. So clearly there is a lot of food that comes into the hospital to feed patients and staff and visitors when there are visitors. But we also think about, you know, way up in the northern parts of Canada or even a little bit more south. Is it reasonable to have locally produced food 100% of the year? Probably not, based on climate, based on weather. And so food is shipped from thousands and thousands of miles across the country. And this stat is true for the United States as well. In our country, food travels about 1,500 miles before it ever gets to a person's plate. And so when we think about agriculture contributing to GHG emissions, it's not only the actual food that we're consuming, but how far does it travel? What is it packaged in? And then industrial processes as well. So those could even be things like concrete development. That's really heavy in greenhouse gas emission, for instance. But I just wanted to kind of get a feel for what things are like to our northern nation sister. Now, this stat of environmental conditions contribute to 25% of global burden of disease. This could be 28% or 19%. It doesn't really matter for the purposes of our conversation together. But what I want to open this up with is that the environment impacts our health. So long we've operated under this understanding in this biomedical, separated healthcare system from maybe some of the more natural and homeopathic or traditional types of medicine and healthcare. But we really thought that taking care of a person, happens within a hospital or a clinic, maybe a little bit within home care, but the way that westernized, industrialized medicine sees the world is very consumptive, very resource intensive. And I want to spend a little bit of time talking about actually the impact of the healthcare industry on the planet. Now, in 2021 now, it's absolutely necessary, I think, when we're talking about healthcare at all, that we contextualize it within COVID-19. And this report from the United Nations came out in July of 2020 that really focused on zoonotic diseases and this hope of preventing the next pandemic. Hope probably wasn't the right word there, but basically bringing the concept of zoonotic diseases more front and center for individuals and helping to explain why these are happening more frequently. And so the UN listed several components that drive disease. And you can see here that I have in orange that climate change is listed as a driver of zoonotic diseases. But looking at this list, there are also many other impactful points that have a connection with our roles as nurses in taking care of people. So for instance, increasing demand for animal protein. We're talking about population. We're talking about the foods that we eat for sustenance. Unsustainable agricultural intensification, same thing, population, greater burden on our agricultural practices, our lands, leads to further land degradation, and basically just unsustainable practices where the industrial ag that we have in place cannot be sustainable for greater people over time, especially as we're facing shifting climatic patterns that have an impact on rainfall, snowpack, permafrost, etc. Increased use and exploration of wildlife, unsustainable utilization of natural resources, increased travel, changes in food supply. So really all of these things have a connection with human health. All of these things connect with our roles as nurses, whatever that may mean. And I did want to draw attention to the fact that the UN explicitly identified climate change as something that's more likely to cause additional pandemics, additional zoonotic pandemics in the future. So why is this relevant for nurses? And of course, I use the term nurse broadly, even though the title of this presentation did make a nod to the clinical space. the things that we'll talk about today also have application for public health nurses, community health nurses, nurse educators, nurse leaders, researchers, everything. And I've really noticed in my personal world, as my nursing path has gone from the bedside to the classroom to now sort of this pseudo environmental nursing, where my patients are like hospitals, and my patients are health systems, that the term nurse just gets broader and broader for me all the time. So our foremother, Florence Nightingale, in the Crimean War, many of you probably know this story, where she instituted some practices that were actually fairly similar to what we do now within the context of public health. This is a letter, this is just a little excerpt from a letter that Florence Nightingale wrote in 1860, where she was talking about the effective of the treatment of open air, or bedroom ventilation at night, diet, improved digestion, open air exercise. I mean, these things that are holistic components of what we understand the nursing practice to be. But we're seeing more and more of this. And obviously we are in the midst of this pandemic that I just spent time talking about. We are very much still learning about how to protect people in the community and how to protect people within the healthcare institution, but we're definitely still learning and clearly don't have it figured out given the morbidity and mortality we've seen with this horrific pandemic. But I also want to push back on this just a little bit. So in my role at Practice Greenhealth and working with hospitals, we do very extensive assessments of waste production. What contributes to a hospital's waste? How much is there? Where does it go? How much does it cost? Is it actually being disposed of in the way that we think it is? We also have done a lot, just learned a lot about how this way that health professionals are having to interact with our clients, our patients at this point, in wearing an outfit, maybe like you see on the screen, or disconnecting the humanity between a caregiver and the care recipient, or wearing a mask in public all the time. You know, we need to do that now. We're told we need to do that now to protect patients, and absolutely we do, to protect ourselves and to protect our community members. But I think there's something to this where we get pulled further away from this connectivity of us as humans when we're no longer able to interact with skin-on-skin touch. We're not able to look somebody in the eyes in the same way anymore. And this applies just to people on the street, to your family members, not just practicing within a healthcare environment. But as we are faced with this more complex, even increasingly westernized, increasingly biomedical model, we run the risk of getting further away from the holistic care that nurses have been working so hard to ingrain in our practice. So we can't forget that. And there will be an uphill battle to go back to some of that more high touch environment. I've talked with a lot of nurses and physicians and other health professionals that have said, I'm never going to practice in a hospital again without wearing a face mask. And I understand that. But I think there's also something that decreases the humanity of care when we have to institute practices like that to be safe. So I shared a little bit about waste as one way that healthcare contributes to the degradation of the environment. But I have a slide here from the Nurses Climate Challenge that shares more about how healthcare contributes to climate change more largely. And this spec of 10% of US greenhouse gas emissions, actually this has decreased a little bit. Approximately 8.5% of US greenhouse gas emissions come from the healthcare sector. And actually, in talking with Jessica Madrid at CANE, I've learned that it's approximately 5% of Canada's healthcare sector that contributes, or 5% of the Canadian greenhouse gas emissions come from the healthcare sector. So we are simultaneously working to improve the health of patients while using the resources and contributing to waste and degrading our environment that impacts human health at the same time. It's this cognitive dissonance. So in looking at this image, you can just see some clouds that kind of allude to where some of these emissions are coming from. Energy, heating, cooling, waste, as I've mentioned, supplies, materials, even fleet vehicles, even how employees get to work counts as a health sector's greenhouse gas emissions. Meat production, waste anesthetic gases, and we'll dig into all of these a little bit more. So if we considered the entire global healthcare sector as a nation, basically, and thought about how the volume of greenhouse gases that were emitted of all of healthcare across the planet, with obviously, you know, our industrialized nations contributing more than unindustrialized or developing nations, we would be the 5th largest emitter as a nation on the planet. So we often look to China and India and the US as the top 3. Canada is not in the top 5, fortunately, but healthcare has an immense impact across the planet. And of course, greenhouse gas emissions contribute to climate change. And this is an image from the Centers for Disease Control that highlights the primary ways that climate change impacts human health. And this is probably not new to many of you on the line today, but I really like this image because it just does an overview of what the big kind of problems are related to climate that connect to human health. So for instance, if we talk about air pollution, the World Health Organization estimates that about 7 million people die annually from air pollution. And beyond death, this also contributes to exacerbations in asthma or COPD, bronchitis, cardiovascular disease, etc. If we looked at environmental degradation, for instance, the UN estimates that by mid-century, so 2050, which is only 30 years, less than 30 years from now, estimates are that there will be 250 million climate refugees. So people who are no longer able to sustain their ways of life in the place that they live, and they need to uproot and move. We've seen this in Syria, most recently, sort of the largest example, but there are also really substantial examples of natives very close to the Arctic regions who are no longer able to sustain their polar bear or their seal hunting because of climatic shifts, and they have to move to survive. So the numbers look pretty grim in this space, and we will see in Canada, in the US, and other areas that have coastal spaces, people will have to shift in due to sea level rise. So all of these impacts on human health, all of the ones I haven't even spoken about, of course, have a very substantial effect on mental health as well. So the layers of the ways that climate change impacts human health and nursing care are profound. And of course, the disparities across populations are very unequal. I shared that I grew up in Minnesota and was there up until this summer, actually. And the event in Minnesota that sparked really a global increase in awareness and a global movement to shift more towards racial equity and social justice, the death of George Floyd, also is an example of how there are certain communities that just bear the brunt of injustice more than others. And that is the unfortunate story that we all have come to know. And when we talk about climate change, these communities, such as people with chronic conditions, those already who don't have a good bill of health, certain minorities, individuals with mental health situations, people who are poor, younger populations, older populations, all experience the inequalities of climate change more drastically. And so, I mean, even from our public health courses and our environmental health courses as we had them, we know that the environment has always impacted human health, but they've not always been caused by the same trigger. And I just want to put this question forward that, have we swapped some of our older threats for newer, scarier, more permanent threats? Are we on the precipice of climate change where there may be, you know, a question of whether we can go back at some point to way of life as we know it, and this all remains to be seen. But these are really big questions that are out there and that we as a healthcare industry will be faced with more and more. So I want to introduce this, this is not the right word, but there's this concept of a personal carbon footprint. And we talk a lot about what can I do? What can I do to help? And that is a valiant and that is a very important, you know, space to fill as humans. We are carers. We want to help other people and we want to help our community. So I want to nudge a little bit at this concept of the personal carbon footprint, which actually was popularized by British Petroleum in 2005 in a very expensive media campaign that was geared towards deflecting the corporate responsibility for climate change, deflecting it away from these corporations and onto the individual, so that individuals feel more compelled, more responsible to take action. And again, keeping that onus off of our companies, off of our industries. Think back to that pie chart that I showed you at the beginning, where over 50% of greenhouse gas emissions in Canada hailed from the energy sector. Well, yes, of course, there are personal actions that we can do in the energy space, and we'll talk about those. But even if every Canadian reduced their energy consumption to what was reasonable, what was livable, in the society that we exist within, we still operate within a system that is very dependent upon fossil fuels, from energy to agriculture to supply creation to transportation. All of this, our system is so entrenched in fossil fuels that individual action will not be enough. We'll talk about individual actions, but keep in mind, this will not be enough. So hopefully you get mad enough that when we talk about policy and advocacy towards the end, you might feel inspired to reach beyond some of these individualized actions. So if this is you, this is good. This is the build up to, oh no, now what can I do? And I want to spend a bit of time talking about how health systems and hospitals are supporting their nurses and other health professionals in integrating environmental sustainability into their work. So first off, there are a few organizations that are really important to know about in this space. The middle one I noted, Healthcare Without Harm, and then the one initiative, or it's really not an organization, but an initiative called the Healthcare Climate Challenge. This little logo on the left basically is a global effort to basically to support health systems in decreasing their impact on climate change. And in 2020, there were more than 22,000 hospitals across the planet that were participating in this healthcare climate challenge. And so that means setting carbon reduction goals for their operations, educating their staff about how climate change impacts their workplace, and then actually decarbonizing their health system, working toward decarbonizing the health economy. And so that means shifting away from this fossil fuel dependence. And then the other thing I want to note, and this is out of Healthcare Without Harm Global, is global green and healthy hospitals. And these map snippets you see above indicate which hospitals in Canada, and this is not comprehensive, but I just took a few in preparing for this conversation, that these hospitals are participating in GGHH, and they are working towards reducing their carbon footprint, but also some more traditional sustainability initiatives like waste reduction and things like reducing harmful chemicals in the workplace, et cetera. But there are hospitals in Canada working on this. If you happen to visit the Global Green and Healthy Hospitals website, and I have a link at the end of this, you can check out all of the specific areas in Canada that have hospitals that are part of this partnership. And so when we think about how those hospitals are taking action, as well as what you can do in your own personal space, these little clouds basically are the alternative to the gray clouds we saw at the beginning. So how do we reduce energy use? How do we encourage collective action, maybe in a green team? How do we make better decisions for our food within hospitals? How do we make better transportation decisions? I'll share some of those. And so whether it's GGHH, Global Green and Healthy Hospitals, or Practice Greenhealth that I work for, they're still the same. It's the same family, by the way. They're still the same sustainability sort of pillars. And you can think about applying these in your own world too, in your own home, with the exception of greening the operating room. Hopefully there's no operating room in your home. But this is just sort of the overview of a few that I want to dig into. So because energy is the #1 producer of GHG emissions, working to reduce energy within hospitals is obviously imperative. And there's a stat out of Healthcare Without Harm that indicates hospitals actually use 2.5 times more energy than like a comparably sized office building, for instance. The lights and other operations are on 24/7. We have very energy intensive machines like CT scanners and MRI machines. Operating rooms are actually very energy intensive because of the lighting and the cooling and the air filtration exchanges that are in place, not always necessarily required. And so I encourage you, first and foremost, to investigate whether there might be a green team or a sustainability team within your hospital or public health department. First of all, figure out if there are other people out there that want to do the same work that you might want to do. And this must be interdisciplinary. You know, it's difficult for nurses necessarily to say, we need to decrease the amount of air filtration within our operating room without having a connection to a facilities person, for instance. But some things can be done independently. So optimize lighting. If there's not a patient in the room, a light never has to be on in the room unless there's staff in there, of course. Or why does the TV need to be on? Or why do those other 6 lights in the bathroom need to be on? I would do rounds. I worked night shifts for many years, and I would do rounds as soon as I clocked in. And my very first thing to do before I even got reports, it shows where my brain was, right? I would walk around, and in our 32-bed unit, in all of the patient rooms that didn't have a person in, I could bet almost every time that when housekeeping had turned over the room, that they turned all the lights on and turned the TV on. And I'd go in and I'd turn everything off. And I would sort of tally, okay, 7 rooms had all the lights on tonight, but there was no patient in there. But that makes a huge, huge difference. Why are hospitals 2.5 times more energy consumptive? Because we use things inappropriately. Or ambient temperature. Does the temperature of a room without a patient in it have to be at 78 degrees, for instance? So just be creative. What would you do in your own house that can be applied to a clinical setting? Turn off computer monitors if nobody's using them. Unplug electronics if you're in a clinic space and won't be there till the next morning. And testing and procedures. All of those are very energy intensive and resource intensive. So if there are multiple tests ordered for patients that maybe if you're an experienced nurse and think, I'm not sure that they need this, you're going to save the patient discomfort. You're going to save money, which is a challenging, situation for all of this. And you'll also be saving resources. And then finally, I've highlighted something called an Energy Star treasure hunt, and this is out of the U.S. Environmental Protection Agency. but it can be applied within hospitals anywhere. And basically, it's a tool, they're free to use, where you can download guidance for how to walk through your hospital or your health setting and identify what some of those gaps are, where energy might just be seeping right out the door without an intentional use. Since transportation is the #2 emitter, think about how you are using transportation. Think about how your colleagues and your patients are using transportation. So how do you get to work? Walk, bike, run, roll, ride? Are there other ways besides a single occupancy vehicle? Can you carpool? Can you encourage leadership within your hospital to incentivize folks to do this same action? So a lot of systems will subsidize bus passes or train passes. A lot of systems will better install bike racks or showers for folks who choose to commute in a different way. There's a really big increase in electric vehicle charging stations recently. And of course, there's this other challenging consumptive side of, well, is an electric car, obviously you're pulling a lot of other materials out of the planet to produce that car. I don't actually know enough to speak about that with much confidence, but this concept of decarbonizing our transportation is very relevant to healthcare, also because we know that transportation emissions, those tailpipe emissions, have direct negative human health impacts on people. So investigate, what are the common diagnoses for emergency department visits? If you work at a pediatric hospital, I almost guarantee you asthma is one of the top, if it's not the top 2, it's probably one of the top 5. Well, why are asthma rates so high? Do you live in a really urban setting? Do you have a very high population of vehicles? So do a little bit of investigation. Are there other detrimental things that transportation in your community is contributing to that could be a co-benefit by reducing that fossil fuel dependence on cars? And how about waste? So specs from Practice Greenhealth showed that on average, one patient in one bed results in 29 pounds of non-recyclable landfill waste a day. And this data is from hundreds of hospitals that we collect data from each year. So we know that the people that we take care of need certain supplies and, contribute to producing waste. It's not the patient's fault. It's not the nurse's fault. We have to use all of these supplies to follow the policies and the protocols within our workplaces. But I definitely encourage you to consider, as you're using these supplies, as you are disposing of materials, is there an alternative to the landfill? There's been a really, really negative downturn in the global recycling market in the last few years. There's a really yucky story about what we understood recycling to be and how many industrialized countries were shipping, including the US. I'm not sure about Canada, but this story is nasty enough that I'll share it. So we're shipping our recyclables, primarily plastic, to Canada. Canada actually had systems in place where they were able to manage that volume of recyclable plastic because they paid their workers so low that they could make a profit, taking those plastic materials and turning them into something new to sell onto the market. But because of very unfair labor wage and basically eventually just an outcry, China stopped accepting these global plastics in 2017. And so if you've seen a shift in your own recycling within your community, that could absolutely have something to do with it. And there are estimates that approximately 10% of the plastics that we put into the blue bin in the US, whatever color the bin is in your neck of the woods, only 10% of that is actually recycled, and 90% of it ends up in landfills anyway. So we're putting it in trucks, shipping it across the country, burning fossil fuels to drive the trucks, and it ends up in the landfill anyway. And so I encourage you to be really creative about how can you keep materials out of the landfill in the first place. And here's an example of some nurses in Chicago who were taking the blue wrap out of operating rooms and making sleeping bags for people without homes, or making tote bags, or creating blankets. Keeping it out of the landfill is the best way to reduce waste in the first place. And how about foodies? So there are many ways to maximize those co-benefits of reducing greenhouse gas emissions from food consumption and also improve human health simultaneously. And so I have a picture of Montefiore Health System out of New York, where one of their cardiac physicians is part of this group called Forks Over Knives. And they have a really big system-wide initiative to serve plant-based meals. And so fewer animal products take fewer resources to produce. We have learned a lot about how much methane cattle in particular produces. So when we eat a lot of beef, when we eat a lot of beef products, there's methane production, but there's also an exorbitant amount of resources that go into growing that cow in the first place, processing those calories into something that we consume. Whereas if we consume the same quantity of calories in a plant-based material, say lentils or something, the resources and the waste that go into producing 100 calories of lentils is far less than what goes into creating 100 calories of cheddar cheese, which is so delicious. And I personally am working really, really hard on this space. There's also this program called the Cool Food Pledge that I want to draw your attention to. And they are working towards basically reducing climate change through the agricultural system. And so they are currently making somewhere over 900 million meals a year more climate friendly. And this also applies to the food your patients are eating, by the way. So how about nurses in the operating room? And you see this image here from Practice Greenhealth that shows all the different ways that money can be saved by reducing the environmental footprint in the OR as well. So I share this because, yes, keeping that financial component in the conversation is really valid, because oftentimes that's what helps encourage leadership to open their eyes in this area. But one thing in particular that I like to talk about within the operating room is anesthetic gases. So there was a report released by The Lancet that identified that one specific area within the operating room contributes to over 50% of the greenhouse gas emissions, and that's anesthetic gases. So these sedative agents that we're using to put patients asleep actually have potencies of approximately 1,500 to 3,500 times, depending on the anesthetic agent, times as potent as carbon dioxide as a greenhouse gas. Basically, the global warming potential is 3,600 times greater for desflurane as it is for carbon dioxide. So it's very, very specific. But nurses can have an influence on this when they're talking with clinicians who use these specific agents in OR cases. That was really eye-opening to me. And finally, nurses are advocates. We've always been advocates, but we need to be climate advocates. So show up. That means showing up at town halls where you are questioning your policymakers about their energy and climate policy. Show up at marches, get signage out there, wear your scrubs, wear a white coat. Show the community that nurses see climate as a human health issue. If you're on this webinar, you're probably already part of Canadian Alliance of Nurses for the Environment, but I've gotten to know this organization much better in the last year in collaborating on the resources for the Nurses Climate Challenge Canada, which I'll talk a little bit about as well. And I have that linked here. Basically, within that program, we have resources to learn how to talk to your nursing leadership, your nurse manager about communicating about climate change as a human health issue. Bring it to a staff meeting, bring it to grand rounds. We have resources where you can download a template for writing a letter to the editor for the newspaper. Or even we have a script for how to talk to hospital administration to work towards divesting from fossil fuels. So those individual actions are absolutely important because it connects you with the issue. They're important because it does decrease your greenhouse gas emissions, whether personally or within the context of a healthcare setting. But more importantly, we need to make this voice louder. So yes, wherever possible, retain hope. And we've learned with this COVID-19 crisis that the world can collectively act on something. We started wearing masks, we started social distancing, we've changed our behaviors. We now telework, many of us. We now have telehealth available to more patients than ever before. And we've seen a clean air response. We've seen reduced greenhouse gas emissions and cleaner water, less pollution, because our behaviors have changed. And so absolutely learn more and talk with others. And so I highlight the Nurses Climate Challenge again here as, at this point, a global initiative to prepare nurses to have conversations with one another about how climate impacts human health. And we have a goal of educating 50,000 health professionals, and we know there are so many more. But you can go to nursesclimatechallenge.org and download any of these resources to talk to anybody, including nursing students, about how climate impacts human health. And just yesterday, I recorded a webinar with CANE about that launch of the Nurses Climate Challenge Canada resources. And so now there are 23 resources right online that are specific to climate change in Canada and specific to the Canadian healthcare system that will be very helpful for you in having this conversation with others. And yes, so do check your own footprint, if only to more strongly connect yourself with this issue and to really become more aware of how the way that you move throughout the world has an impact on the environment. And this, this collaboration between basically CANE's American affiliate, the Alliance of Nurses for Healthy Environments, and actually Project Drawdown, called Nurses Drawdown, shows several areas for action that are specific to nursing, many of which we've gone through today. So you go ahead and join Nurses Drawdown as well and learn how you can take action in the realm of energy, food, gender equity, mobility, and nature. And so when we think about the challenge that's before us and the really sticky wicket that we are in as nurses, trying to care for patients whose health is impacted by the environment, we need to have the vision of a healthier future. We can't move forward in the appropriate direction and bring others with us if we don't have the vision. And we can do that collectively. So we must imagine what healthy people living together on an equitable, thriving planet can look like. So with that, I'm just going to go to my last slide here, and we'll share these resources with you after the call today. But absolutely, I am very engaged and want to stay connected with all of you if you continue to want to be in conversation about this with CANE, with Healthcare Without Harm, with Global Green and Healthy Hospitals. So dig in a little bit more, and would love to carry this on together. So Jack and Fiona, I'll hand it back to you if questions have bubbled up on the time so far.
I don't see any questions in the chat, but we will open up the floor for questions, any questions you have. The other thing I want you guys to do is, if you do want a copy of the PowerPoint that Shanda is willing to share, if you can just write your email in the chat, and that way we'll make sure to forward it to you.
I would maybe have a question then, Shanda, just about maybe what you've had a big change in the US just very recently with the election of Joe Biden and the agreement that and the up in Canada, I guess we feel that offers us some new hope for climate action. The US is going to be rejoining the Paris Agreement and so forth. So I'm just wondering what your thoughts are on this, as we start this new year, 2021, from, with the new political administration.
Yeah, thank you, Fiona. That's a really rich conversation topic, I think, for all of us. During President Trump's administration, we saw a lot of rollbacks for environmental protections across the board, whether it was related to climate specifically, like the Paris Climate Accord, whether it was related to drilling, even water protection legislation, national parks. And for those of us who sit in this environmental space, it was very baffling and very disheartening, especially as we're sort of looking at this clock ticking down based on the Intergovernmental Panel of Climate Change saying that we have until 2030 to decrease our emissions by 50% and decarbonize even further. And so very disconcerting during that time. Now with the change in administration, you referenced getting back into the Paris Climate Agreement. He also has signed into action some legislation related to the Keystone Pipeline, which directly relates to Canada, for instance. And I think we're going to see a lot more activity around climate and environmental legislation generally. And from the Healthcare Without Harm perspective, we have put forward policy recommendations for the Biden-Harris administration that bring human health into the conversation. From the Alliance of Nurses for Healthy Environments angle, they've released reports that do something comparable, always bringing human health to this environmental cause. And I think as nurses, that is one thing that we really need to do a better job about. It's one thing to be up in arms about our climate situation, but in helping people understand that this directly impacts human health, I think that increases the likelihood of bipartisan support. I think it increases the likelihood of just more aggressive action that needs to happen when we put it in the context of supporting human health. Now, personally, I think planetary health should be enough, should absolutely be enough, just given this undercurrent that we rely upon the planet, and that seems so clear. But that added message of, and this is why it matters for humans. I think in the context too of COVID-19, we're starting to really try to shine the light more on that intersectionality of COVID and climate and human health. And of course, racial equity and social justice, all of this like big complicated ball of wax that always has been complicated, and mixed up together. But drawing attention to that seems to be making it more likely that leaders understand the connectivity.
Wow, that's a very comprehensive answer to a complex situation and question. Thank you so much. I don't know whether anybody else has a question that they would like to ask.
Hi, this is Marilyn. I'm just on the phone. I was curious if you could share like some recent projects that you're working on. Just to give us a bit of an idea.
Yeah, absolutely. Thanks for the question, Marilyn. So I like to talk about some of the projects that I work with other hospitals on in the context of Practice Greenhealth. And so let's see here. There has been some pretty exciting work around, this kind of comes from the energy space, but around renewable energy. And in some states in the US, there are really substantial what's the word I'm looking for? Basically reimbursements that hospitals can get from their state government, and in some cases even the federal government, to create solar panels on their roofs, or to establish a solar field, or maybe even better, community solar gardens. I don't know if you have that type of setup in Canada, where a large organization can buy a big part of a community solar area, and then other individuals in the neighborhood can buy into that. So we're seeing a lot more movement in the solar, a little bit in the wind space too. Some other work that's really exciting that's happening, and this actually relates more to the chemical space, but there has been so much more light shown on the like DEHP and PVC and all of these complex compounds that are in a lot of the materials that we as nurses and patients and other health professionals work with, and the teratogenic and carcinogenic effects of those materials. And so a lot of hospitals are working on phasing PVC and DEHP out specifically. Another exciting project actually relates to the Nurses Climate Challenge, and there are a couple hospitals, one in Montana and then one in Washington, that are working with their nursing education department to include climate and health education as part of kind of like the mandatory education suite that nurses receive annually. Other hospitals are including educational content on their environmental sustainability initiatives with new employee orientation. And I think generally we're also just seeing this increase in connectivity between diversity, equity, and inclusion and environmental stewardship. And oftentimes that comes down to supply chain. It's really fascinating to me. Healthcare is such a huge consumer of goods from a financial perspective that if hospitals actually kind of sort of consider themselves an anchor institution within their community and buy from local companies, purchase materials from minority-owned businesses, there's a lot of investment that can happen within the DEI realm that also better supports and reduces the greenhouse gas emissions from that healthcare sector. So just like what we purchase at home, we want to know more about, where did this apple come from, or how far did my t-shirt travel before I, purchased it from Sears or whatever. It's really important to be a mindful consumer as purchasers within healthcare, and nurses can help by pushing that question forward and saying, well, where do we get this from? What do you know about this? Are there other organizations or companies that we could buy from? Yeah, thanks for the question.
If there's no other questions, that was so interesting, but I would be curious if you would have a little bit to share, if you know any particular story, because I feel like the pushback we often get, and maybe it has to do with the public system, but it also has to do, I think, with interest and education within management and corporate healthcare positions, is that there's the bottom line. The bottom line is always financial, so that there's not even room for it. So I'm just curious if you know any more about those stories where they're able to change that bottom line to include supporting more local and more minority owned, etc.
Mm-hmm. Yeah, that's a great, yeah, absolutely. That's an excellent point. And there's actually a tool. Well, before I talk about that, I want to introduce this other org called the Healthcare Anchor Network. And basically they are collaborating with Healthcare Without Harm to make this happen for about 50 health systems across the US. So that institution is what this is all occurring through. And they have a lot of resources around how to help make that argument. And from the bottom line perspective, the thing that comes to mind right away, and I don't have numbers off the top of my head from any particular case study. I would encourage you all to check out Healthcare Without Harm, and a lot of that exists was on there. But there's a tool called the Total Cost of Ownership tool. And basically what that does is, you know, say you have a syringe, just a 10 mil normal saline syringe, excuse me, and you can input that into this calculator, and you indicate what company you purchased it from, and it can show you over time what the cost is of the actual material itself, what the cost is of the transportation, and also more importantly, what the cost is of disposal. There are other components that factor into there too, but it really breaks down how does whatever this supply is, how does that cost the organization and why? And so if you can make that argument for, well, the transportation of buying something from Toronto right in our neighborhood is far less for that transportation than if we bought it from Vancouver, for instance, or if we can dispose of this, if there's actually a recycling stream and we're not taxed on recycling these items, and we don't have to pay an additional fee for putting into the landfill or incinerating it, you're saving money on the disposal fees. So really breaking down through that total cost of ownership tool, where are we paying extra for stuff that we could, you know, we could be putting that funding back into the community in a different way. So yeah, investigating what makes up the price of a product or any service that you're purchasing through healthcare, for instance. Yeah, great question.
All right, everyone, that's about all the time we have for questions. Fiona also had an announcement to make. So if you guys have any other questions, you can always message myself. I'll put my email in the chat and I can forward them to Shanda as well.